Hi, I'm Brian Murphy. Welcome back to the Chilmark Research Channel. I wanted to take a few moments today to talk about a topic that's tangentially related to our upcoming report on integration infrastructure. But before we get started, I am, as always, required as a condition of employment to remind you to click like, click subscribe, and best of all, click the notifications bell. That way you'll find out when we post new content. COVID vaccination season is upon us, and if you're like myself and everyone else I know, you're trying to figure out when and where that can happen for you. Here in Massachusetts, everyone who gets vaccinated also generates some reporting. The CDC is informed, the State Department of Public Health is informed, and the payers are informed. So the availability of those immunization records in doctors' offices, in clinics, in hospitals is anything but an open and shut case. One of healthcare's least enduring aspects is the number of duplicate questions that patients have to answer in any exchange involving healthcare. So I think it's going to be a fairly common question over the next 18 months whether or not you've had a COVID vaccine. The availability of that information in EMRs and in EHRs is going to be spotty for some time to come. It'll be available in some places, it won't be available in others. One aspect of our upcoming report on integration infrastructure is the lengths to which vendors are going to make things like immunization records far more available to EMRs and EHRs and other healthcare players than they have been in the past. So the availability of immunization records inside EHRs and EMRs is just another example of how COVID has exposed some of the deficiencies in the healthcare system. We can only hope that wider availability of this kind of information inside of EHRs and EMRs can let patients off the hook a little bit in terms of repetitive questioning. So while everyone is chomping at the bit to get their vaccines, and who can blame them at this point, you can rest assured that the state public health departments and the CDC are on the case in terms of collecting the data, and now all we've got to do is make sure that other people in the healthcare system get access to it as well. Thank you very much for watching, and if this is your first time, welcome to watching Chilmark videos. If you have any questions at all, please leave a comment and someone will get back to you. And as always, if you enjoyed this video as much as I enjoyed making it, please give it a like.